Welcome back to San Antonio Living. You know, everybody's getting sick right now with the allergies. They're not feeling well, and sometimes you don't have time to wait 4, 5, or even 6 days to see a doctor. Well, we have the perfect solution for you. It's a freestanding emergency department. We're talking about complete emergency care. And here to tell us much more about it, we're talking to Tim Boo. He's the medical director. How are you?
Good. Thanks for having us.
I'm really excited to be here because you're telling me that if I'm feeling bad or have an earache or a headache or something, I can come see you immediately and be seen in maybe 5 minutes.
That's right. We have a 24-hour emergency center staffed by emergency physicians and emergency nurses. And one of the biggest problems that we've heard is people don't want to have the extended wait times in a regular ER. Mm-hmm. And sometimes, you know, emergencies never happen at your convenience. So it could be any time of the day without an appointment, and we're here for that. Whether it be a really bad earache or chest pain or abdominal pain, mm-hmm. We are able to provide services for that.
You guys are as convenient as what you are, very convenient.
Absolutely. Mm-hmm.
It was just like you mentioned, emergencies, yeah, they never happen whenever you plan on them. You never plan
they
for
just
an emergency.
never happen when you expect them to happen. So,
so we have you to turn to. And, you know, we were talking about this before. You guys had been around for some time, but your location on the Culebra has been around for about a year. As of yesterday, you hit your 1-year mark, haven't you?
We were emergency center as of 1 year yesterday, but the location, we've been there for actually 4 years. Okay. And now we've expanded our services to 24 hours. We have a full lab, CAT scans, and always a doctor and a nurse there.
Okay. So talk to me, as one of the patients that might be coming in to see you, maybe some of the symptoms that you've seen lately.
Well, being an ER doctor, one of our unique strengths is that we want people to come in at the earliest sign of a problem instead of ignoring it for whatever reason. They feel like it's too long of a wait, or they feel like they can't get to their doctor in time, so they ignore the headache, they ignore the chest pain, and we are able to see all of those things. And emergencies come in different shapes and sizes. For some people, it's a bad cut on their hand, or they just have debilitating allergies or an earache or something, and they need to be seen now. And that's something that we can really provide for them.
You'll see them right now. That is reassuring to know. Well, what if, let's say, I come in with a bad cut in my hand and it needs to go further, I need to see another doctor. You guys can actually refer us to somebody else also.
Yes, absolutely. So our ER doctors are more than capable of handling your typical injuries. But if you ever did need a specialist, like a hand surgeon or whatnot, we have a whole network of doctors that we're able to refer to, and you can get follow-up within 1 or 2 days.
Well, let's talk about ages, though. I guess there's never a specific age whenever something will happen when you don't expect it to. Do you turn anybody away, any case away?
No, we don't. That's one of the specialties of emergency medicine, is being able to handle different ages, different emergencies, whatever they may be. And so we're more than qualified to do that.
You know, how about, like I mentioned before, I have a lot of friends going in for allergy testing right now. What about tests and maybe some lab work? Do you guys also do that?
We do majority of all tests that you'd find in an ER. So they'd be your basic lab work, emergency-based tests. We do flu testing, strep testing, things that you would really need to be seen for within the next day or two especially. But we do treat a lot of people with debilitating allergies who can't get to work the next day and they need to be seen, and they can't wait for their appointment or a visit with their allergist. And so we're really helpful as far as getting them back on the road.
You know, one of my favorite things about going to the doctor, I'm sorry, Tim, is not always the best thing to do. It's not always the most fun thing to do. But I enjoy making a relationship with my doctor, somebody who really, I guess, gets to know me and I get to know him. Can you create that same thing also?
Yeah, so that's the biggest thing that we've heard from patients is they spend more time in the waiting room and not enough time with their doctors. So we're kind of the opposite of that. We minimize your wait time, and most people when they leave the ER, they feel like they've really had their questions answered. And at the most critical time when they're most worried, whether it be a family member that's having chest pain or appendicitis, they really want to make sure that they're being treated well and getting all their concerns addressed.
Very good. Well, so we can become good friends. All by getting cared for very quick. That's very good to know. You don't need to wait for 4-day or 5-day appointments.
Not at all.
So glad to know. Thank you so much for letting us know. We're actually going to be working together more often. And so we're going to be getting very close with all the San Antonio Living viewers and all the great things that you guys have to offer. Let me leave everybody with some more information. We're talking about complete emergency care. They're located on Culebra Road. It's 10628 Culebra Road, Suite 200. You can give them a call right there on your screen at 210-520-30. 3737. Or, of course, look online at CompleteEmergencyCare.com. And, hey, they're on Facebook. It's Facebook.com/CompleteEmergencyCare. Dr. Tim Vu, thank you so much for being here. All right, guys.